Hello and welcome to today's episode of Community Connections, airing right here on OROMIA11. I am your host, Anna Orr, and we are still talking all things diabetes awareness. During the month of November, you know that Diabetes Awareness Month is taking place, and we are trying to provide you with the most up-to-date ways to connect and stay educated about what's going on with you, and I'm sure someone in your network. Today's guest is Carolyn Sherritt, and she is the Executive Director for Breakthrough T1D Diabetes program here in the Dakotas as well as the Twin Cities. We're going to talk about awareness. We're going to talk about what type 1 diabetes looks like in youth and adults, and some really cool ways that you and your family can stay connected to diabetes prevention and awareness. This is going to be a wonderful episode you won't want to miss. Thank you for joining me, Carolyn Sherritt of Breakthrough T1D. Today here on this episode of Community Connections, we are talking all things diabetes and awareness and prevention. So thank you for joining me.
Thank you for having me.
Now you are here as the Executive Director of the Dakotas and Minnesota chapter of Breakthrough T1D.
Yeah, that's right.
Can you talk about the work of your organization and kind of a little history for those of us that are not familiar with your work?
Yeah, thank you for that. Breakthrough T1D is formerly known as JDRF. So we recently went through a name change this summer. JDRF stands for Juvenile Diabetes Research Foundation. Type 1 diabetes is not just a juvenile, it's not just diagnosed in kids anymore, or ever was. About 50% of newly diagnosed people with type 1 diabetes are adults. And so we as an organization determined that it was time to change the name of our organization to reflect the population that we are serving, which is everyone with type 1 diabetes. As an organization as a whole, we are striving to make life with type 1 diabetes easier for individuals and their caregivers as we are working towards breakthroughs to cures for type 1 diabetes.
Now, people are probably very familiar with the former name you guys mentioned as the Juvenile Diabetes Research Foundation. You guys are one of the leading foundations in the country doing this type of work.
That's right.
And you all changed your name not only to try and do any type of rebranding or anything like that, but it was to actually lock in on the focus of your scope of who you serve, correct?
That's exactly right. So even in research circles, they don't use that juvenile tag anymore. So we, made the hard decision, thoughtful decision, I guess I should say, to go through a name change to, again, be able to accurately reflect the population that we're serving and be more thoughtful about how we are achieving and striving towards breakthroughs in type 1 diabetes research, as well as therapies that improve the lives of people living with type 1.
Now, I was just having a conversation with someone the other day, and they were saying to me that they didn't know that there was 2 different kinds of diabetes.
Yeah.
Until they watched a segment on something earlier this month. And I said, I think that's really important because so many people just hear diabetes and believe we're all talking the exact same thing. Can you talk about the differential split between type 1 and type 2 diabetes?
Yeah, so type 1 diabetes is an autoimmune disease. So just like any other autoimmune disease, your body decides, I don't like this function in your body, and it decides to attack it. In type 1 diabetes, your immune system attacks the beta cells in your pancreas, which are the cells that create insulin. So when you are diagnosed with type 1, you are dependent on external insulin for the remainder of your life. That is before every meal, throughout the day as your blood sugar gets higher or lower. Whereas type 2 diabetes is your body becomes insulin resistant. So your body still produces insulin, but your body uses it is not as effective in using it.
That makes a lot of sense. What are some of the symptoms that you would notice or somebody watching this may need to pay attention to in themselves and or a loved one?
Yeah. So symptoms can be, the most common symptoms are excess thirst. And when I say excess thirst, it's like I cannot get enough water. Frequent urination. And part of that, those two things, is your body's way of trying to get the excess sugar and glucose out of your body. Fatigue, a sweet smell of in your breath, are frequent signs, but most individuals and their caregivers are looking at, first notice the excess thirst, the frequent urination, and then as your symptoms progress and are left untreated, blurred vision is kind of the third indicator that people go, oh, maybe we should go see our physician about this.
And are some of these symptoms similar in adults that are the same in children?
They're exactly the same.
Okay.
So, an infant doesn't really tell you that they can't tell you that they're thirsty,
Right.
But parents will notice that they are just constantly changing diapers that are almost like they've been dunked in a pool by how saturated that they are.
Now, we here at OROMIA11 have a predominantly African and or Black viewership here. Can you talk to me about some of the disparities you guys are recognizing on the research side for African Americans having a disproportionate outcome of being diabetic and or pre-diabetic?
Yeah, that's a really good question. And, to be quite frank about it, I think the disparities that we see in health equity in general are the same, whether it's for type 1 diabetes, type 2 diabetes, or any other medical condition. This is, often a delay in diagnosis or a misdiagnosis. I think there have been studies that have shown that African American adults and adults in general that are have onset of type 1 diabetes in adulthood are misdiagnosed with type 2 diabetes, and that can be exacerbated in the African American community as well. And so this delays diagnosis, this delays the continuous insulin care that you need, and can lead to more harmful outcomes down the road. When you talk about research, minorities in medical research across the board are underrepresented. I think that, people in the African American community are very underrepresented in type 1 diabetes research in general. And I will just make a call out that, if you are living with type 1 or you have a loved one with type 1, there are clinical trials and research that are happening across the country, and even here in Minnesota, that I strongly encourage you to look into. Yes, some of them are drug related, but some of them are, looking at, more cultural differences or socioeconomic differences. What your day-to-day life looks like, right? Behavioral research that you can do right from your own home. And so I always encourage people of all different backgrounds to look and see what is available to be a participant in research, because we need more people from all different kinds of backgrounds to be able to get our cures advanced further and faster.
I think you said it. There is so many socioeconomic reasons that are contributing to this factor. If you live in an area that doesn't have local health care, if you're living in an area that is a food desert per se, how are you making better food choices if this is all that's near you?
Yeah.
And how often, like you said, are you going either misdiagnosed or undiagnosed altogether?
So to address the question about food, right? Food deserts and having access to healthy food options, I think for communities of color and urban communities in general is a issue that I am personally, I I understand that, and it has ramifications across the board. But for people living with type 1 diabetes, right, I think that there's this misunderstanding that if you have type 1 diabetes or type 2 diabetes, right, you can't have sugar, you have to watch your carbs, you can't, you have to restrict what you are eating. And of course, making better food choices is better for a number of different reasons, right? But what that does, those implications are for people that have type 1 diabetes is, the higher your carbohydrate intake, the more insulin that you're going to have to use to be able to keep your blood glucose in a normal and healthy range, which means that you are going to be going to the pharmacy more often, right? How far do you have to travel to your local pharmacy? What does your insurance coverage look like, right? We're really lucky that, there is a cap on the cost of insulin, but if you are utilizing more insulin because of food options that are available to you, that is going to cause, it's a domino effect, right? And so if we can, help, not help people, but, there's a whole systematic, issues for that. And if we can play our role as a healthcare-based organization to encourage some of those changes in our local, state, and national policies, the better off our healthcare outcomes are going to be across the board.
Now, you made a reference earlier about the work you guys are doing on the research side and people participating in things like this, but we know that no cheese stands alone.
Yeah.
You guys, I'm sure, have community partners and organizations that you guys are working to bridge the gap, not only from the research side, but also education and awareness. What does those partnerships mean to you guys at Breakthrough Type 1 Diabetes? And how does it help you guys stay connected to the pulse of what's happening to people that are dealing with type 1 diabetes every day?
That's a great question. So on the research side of things, we have within Breakthrough T1D research that we're doing ourselves, but we also fund research across the country. Here in Minnesota, we have a very large grant at the University of Minnesota, and a lot of their work is actually on detection and screening. So there have been breakthroughs in screening in the last number of years in that you can take a blood test and it will tell you if you have the antibodies for type 1 diabetes. You may not show the symptoms, you may not be at the point where you are dependent on insulin, but it can give you an indicator of whether or not you're at a higher risk of developing. And then there's a whole host of options that come after that in terms of, drugs that can help delay onset, but also now you're more aware of, okay, I really need to keep an eye out for the signs of symptoms of type 1 diabetes so that I know that I can go to my physician right when I start seeing them and not, I'm a mom myself. I have looked at my kids and be like, I think we can wait another day before we bring you into the doctor. I think you're going to be okay. And so if you know that you're at a higher risk, right, you will be more inclined to take the additional steps if needed when you start seeing signs. From a smaller basis, we work with healthcare partners across the country. We have really strong healthcare partnerships here in the Twin Cities area as well as throughout the region. Children's Minnesota is a very strong partner of ours. But then we also work with endocrinologists that have a patient population that are, East African descent. There is a higher incidence rate in people that have a Somali background as well. And so we work really closely with them to make sure that they are able to pass on our resources to those patients when they're newly diagnosed and let them know that there is a community of others with type 1 diabetes that they can connect to, because it can feel isolating and alone, and that you are it can be very overwhelming for a parent or an individual when they're first diagnosed. But just to let them know that there's a community here full of people that are ready to say, unfortunately, I've been in your shoes. I'm sorry to welcome you to the community that you never thought that you would be a part of, right. But we're here for you.
Now, you mentioned a higher rate of diagnoses in the Somali population. What do you feel could be some of the contributing factors to this uptick that we've been seeing?
That's a difficult question. There are certain populations around the world that just genetically have a higher incidence rate of type 1 diabetes. Scandinavian countries have a higher rate of type 1 diabetes as well. It's just like any other diseases that, there are certain patient populations that have a higher incidence rate. And we've been able to identify that Somali people from Somalia and that have a Somali ancestry just happen to have a higher incidence rate.
I encourage viewers to stay on top of that and pay attention if you are someone that has not only experienced the symptoms that she has talked about, but found yourself a part of the Somali population and want to know, is this something that I could get ahead of? Is this something my children are experiencing? Please make sure that you are talking to your primary care physicians. Now, switching gears just a little bit, how are you guys actively working to reduce stigma? I feel like diabetes is one of those situations. As far as I can remember back talking to elders in my community, they would say it's the sugars and, it's just so normalized. Or they would say, it's fine. And it's like, well, I don't see you taking your insulin, or I don't see you staying on top of it. How are you guys at Breakthrough T1D actively working to reduce stigma around this?
That's a good question. And part of that, the first step in that is just awareness, right? That visibility that it exists. It's not something to be afraid of or that makes you different from others. I hear stories from, school age kids that are involved in our youth ambassador program that talk about, that at their school, they're the only one with type 1 diabetes. And so they, put their devices on their body where it's not visible. And then they come to their first youth ambassador meeting, and it's in a room full of school-age kids that also have type 1 diabetes that are, wearing tank tops and shorts and, don't really mind that people can see it, and it just becomes a little bit more normalized. And so we are, one of the rewarding things is to be able to see over the course of the school year, our youth ambassadors being more confident. I hear stories a lot of moms and dads or, adult caregivers watching their loved ones in public go up and be like, hey, I see you have a glucose monitor on. Do you have type 1 diabetes? I have one too. Which brand do you use? I have this pump. And just become more comfortable in opening up those conversations. And when we have, I've been sent a number of pictures. There's a store at the Mall of America that has an advertisement where somebody is wearing a glucose monitor in their retail window. And it's that visibility that, brings that awareness to others out that don't have type 1, that don't know what type 1 is, doesn't really know what that means, out into the open, and so that we are able to educate more about the signs and symptoms, because incident rates across the board are going up for type 1 diabetes. And we just want people to be aware of, again, signs, symptoms, the opportunities to screen, so that you can be aware and watch out for symptoms and get the care that you need as soon as possible.
I think that's well said, Carolyn. Can you share how you all are utilizing ethnic media and or social media to connect with your target populations and or the community at large?
Well, I will be very direct and say this is my first experience with minority media to invite us here. So thank you for the opportunity to reach I'll be honest, I'm not part of, right? And so anytime that we have the opportunity to bring awareness of our organization and type 1 diabetes into a new community, we raise our hands, say yes right away, because we want people to know that we exist. I think that's part of the challenge that we have as an organization, is that we know that there is a type 1 population here in Minnesota, North Dakota, South Dakota, across the country, that doesn't know that we exist as an organization. And we want everybody to know that we exist. There's a community here for you. You are welcomed here. There are people that are ready to answer your questions, ready to make you not feel like you have to go through this on your own. And we're here for you.
I think it always helps to know that you are not in this alone, no matter what the subject matter is, or that you're not the only person that something is happening to.
Yes.
Now, for anyone that is interested in finding you guys on social media, where can they find the work of Breakthrough Type 1 Diabetes?
That's a good question. So for our local chapter here in Minnesota, our Facebook page is where you're going to find any like community engagement activities that we have coming up, any events that we have coming up, as well as we share all of our resources, kind of general nuggets of, from our advocacy group, as well as from our research and updates on that. And then our second place so that's for more of the parents, I would say. But for our younger folks affected by type 1 diabetes, we are also very active on Instagram. Breakthrough T1D Minnesota, you can find us through searching either of those. We do have LinkedIn for the professionals out there that want to get engaged in the work that we're doing and want to connect that to their professional lives as well. We're kind of across the board there. Yeah.
I think that's wonderful. Now, do you guys have any upcoming events taking place that the community at large can come and stop by and start actively taking control over their diabetes and or check their A1Cs?
Yeah. So the program through the University of Minnesota is called TrialNet. And it is free blood screening. So if you have a relative that has type 1 diabetes, you can call them up. They have screening events across the metro as well as at their location I've seen entire families, children through adult, parents, adults, get screened. I highly recommend doing that. For folks that are already, diagnosed or living with type 1 diabetes, we do have our community summit coming up on February 22nd at the Mall of America. This is our education summit. So we have speakers that come in and speak on all types of content, including research, including mental health, right? So we talk a lot about the mental health journey that comes with living with type 1 diabetes. Type 1 people that live with type 1 diabetes and their caregivers make over 200 medical related decisions a day, and that can be extremely exhausting. So we want to provide the resources and the knowledge to help with that. We also have a community connection at our community summit as well. And for parents out there, we also are providing daycare. So we want to be sure that we are having an event where people can come and get the information that they need and know that if they have family care that they need to take into consideration, that we're taking that into consideration as well. And then our big event is in May. So we have a walk that is at the Vikings training facility in Eagan at TCO Stadium. We have 8, 9, 10,000 people that join us every year. And it is a big community celebration of celebrating life with type 1 diabetes. We have a type 1 parade, so we encourage everybody that joins us that day to come and be with their other type 1s. And again, it helps reduce that stigma that we talked about, and celebrate life with type 1 diabetes and the challenges that come with it, and also to celebrate our advances in the cures that are coming up as well.
I think that is so poignant that you guys are creating multiple avenues for people to get engaged and to stay informed about this very, very important work.
Yeah.
And this very important subject. Do me a favor, lastly. I just want you to look directly in this camera here and give an invitation to somebody that is interested in talking to their primary about diabetes or bringing their child in. Just give them a bit of a nudge to let them know that the work of Breakthrough Type 1 Diabetes is there for them and that you guys are out in the community still working at it.
Yeah, I guess I would say to an individual or a caregiver that is thinking, oh, maybe something's not right here, listen to your gut, advocate for yourself. Nobody else is going to do it for you. Go see your primary care or just go into your local clinic and say, you know, something doesn't feel right. And these are the symptoms that we're seeing. It can be scary and it can be overwhelming. But there are medical professionals that are there to help you along the way. We call them outreach ambassadors. We have volunteers within our community that are the first contact points for people that are newly diagnosed with type 1 diabetes. We also have, we call them care kits for people that are newly diagnosed that are either provided to you at your local physician's office or are sent to you in the mail. And they are all age appropriate. So for our school age kids, comes with a teddy bear named Rufus that also has type 1 diabetes. And he comes with patches on his body where people would inject insulin. So it's used as medical play, so it makes it not so scary. It comes with books for kids and resources for parents. We have teen kits that come with cool, colorful patches to cover your CGM devices, as well as age-appropriate resources for that. Sleepovers are a big question that we hear a lot about. And then we have adult care kits, because we know that people are diagnosed in adulthood. So we really try to diversify our resources to make them age-appropriate. And again, there's people that are living with type 1, that have been living with type 1 for many, many, many years, that are here to help you along the way. But trust your gut, go see your doctor, and then you can avoid some of the really scary complications that can come along the way.
Thank you so much for that note, Carolyn. And thank you for joining me today. I wish you all at Breakthrough T1D a really successful Diabetes Awareness Month. And I hope that you all are able to watch the reduction of new diagnoses take place in your lifetime.
Yeah, thank you so much.
Absolutely. Unfortunately, that is all the time that we have for today's episode of Community Connections. As always, I am humbled to connect with you here through OROMIA11 Media. I look forward to connecting again with you soon. Take care of yourselves and the people in your network.